Hello, everybody. I'm Anthony Gonzalez, and I'm the program coordinator for the Higher Education Center for Alcohol and Drug Misuse Prevention and Recovery. I'm joined today by my colleague, Logan Davis, and we're very excited to welcome you all today to our webinar titled University Presidents' Perceptions of Alcohol Policies for College Sporting Events, featuring Dr. Castor and Dr. Glassman. Before I get started, I do just have a few housekeeping slides I'd like to share with everybody. Here on the screen should look somewhat familiar. It is the Zoom dashboard that you should see before you. We do have the chat and Q&A enabled for today's session. We do welcome your questions for our presenters today. If you do have specific questions, please put them in the Q&A box so we don't miss them in the chat. Additionally, we have live captioning available today, and you can turn that on through the bottom dashboard. If you have any trouble setting that up, please feel free to reach out to me via the chat. I would like to share some upcoming HEC-AOD events that we have happening next month. We have the third session in our Environmental Prevention Learning Collaborative, and that is titled Engaging Community Partners, and that's happening April 6th, and you can learn more about that session and the series by visiting our website. Additionally, we have a water cooler chat happening on April 12th, and that is titled Friends Helping Friends, the Intersection of Prevention and Recovery, and that is moderated by Christina Canfield. And with that, it is my great pleasure to introduce you to today our two presenters. Joining us, we have Dr. Castor. He's an assistant professor at Radford University in the Department of Public Health and Healthcare Leadership, where he serves as the undergraduate program director for the Bachelor's of Science in Health Sciences and Bachelor's of Science in Public Health degrees. He earned his doctorate in health education from the University of Toledo. He teaches principles of public health, principles of health education and promotion, program planning and evaluation, fundamentals of healthcare research, and health communication and social marketing courses. His research is focused on alcohol, tobacco, and other drugs and addictive behaviors of college-aged individuals. Joining him is Dr. Glassman. He is a master's certified health education specialist and a certified communicator in public health. He earned his doctorate from the University of Florida and a master's in public health from The Ohio State University. He teaches drug awareness, human sexuality, mental health, social marketing, health communication, and health behavior courses. His research interests involve the prevention of high-risk behaviors among college students. For example, he designed interventions to reduce the excessive alcohol consumption associated with tailgating on game day, 21st birthday celebrations, and spring break. Further, he designs, implements, and evaluates health communication messages which promote healthy lifestyles. Thank you both for joining us, and it's my pleasure turning it over to you both at this time.
Thank you for that wonderful introduction, Anthony. We're both very excited to be here, and we're looking forward to sharing what we have with you today. Dr. Glassman is pulling up the materials here. I want to thank everyone for joining us and taking the time to sit through this hour-long webinar with us. Next slide, please, Dr. Glassman. Thank you. So this, full disclosure, this is doctoral dissertation research, and this is not just one individual's research. This is a collective from a lot of different inputs from a lot of different individuals. And I want to spend a minute and say a special thank you to all the individuals that work so diligently on the team. That would be Dr. Stake, Natal, Blevos, and one name that you might recognize here, Dr. James Lang, the director of the Higher Education Center. Today's presentation is focused around three key objectives, the first of which examining which prevention strategies university officials are most likely to implement during college sporting events, discussing the use of theory in terms to facilitate policy change on college campuses, and as well as exploring strategies to influence university presidents' readiness to implement any policies or change on their college campus. Hopefully there'll be a few other key points that you all can take away with you and implement in your practice or in your research initiatives in the near future.
So a little bit of background information. We all know that college students drink at higher rates than most population groups, but there's a special category called event-specific alcohol consumption. What is that? This is sometimes called celebratory drinking. And think about the drinking that's associated, well, we just had St. Patrick's Day. What happened on your campus? Some students are on spring break. These are times when students would drink even more than normal. and consequently experience more consequences. We know 21st birthdays are a time where some students really go overboard with their drinking. And the thing about an intervention like this, or an issue like this, is it requires a specific intervention to address it. And again, people have a tendency to drink at higher rates than normal, which is already high. So a particular niche area is the alcohol consumption associated with college sporting events. And we know that this is a time where, an event-specific time where people drink more than normal as well. Most of the research here is designated toward football games. We refer to this as game day, but it could also apply right now. We have March Madness going on. I imagine there's going to be some celebratory drinking going on as well, but mainly the tailgating associated with college football is what we're looking at. And anybody who's ever tailgated, we know it starts before the game, a couple, 2-3 hours, sometimes during the game, sometimes after the game. So it can be quite an extended period of drinking, hardly moderate drinking by a lot of folks. And of course, we refer to this as tailgating. Most teams typically have 6 home games. So if you're at a big university, like I attended the University of Florida and Ohio State, I went to lots of football games. Ohio State, the shoe, seats 100,000 people, and there's another 50,000 people on campus and many more on High Street. Same thing with any big football program. So we're talking about a lot of people. So it really, truly is a public health issue.
And just to touch on that as well, Dr. Glassman, a lot of the universities that were invited to participate in our particular study have student bodies that can range in excess of 60, 70,000 students. Like you said, they have stadiums that can seat 100,000 individuals. And obviously they draw parking lot partiers in massive excess of the 100,000 individuals. They might not need a ticket to party in the parking lot, but they do need one to get into the stadium. Mm-hmm. So just to bore you all with some data, this is data from the current literature. All of this data is from football game day attendees. And these are scientific peer-reviewed journal articles. So anywhere between 50 and 88%, depending on the research, of game day attendees actually consume alcohol in some amount. That is particular, again, to college game day football games. Among that number, 40 to 58% of those individuals that are consuming alcohol consume at high-risk drinking patterns or high-risk drinking rate. And if you're not familiar with what the high-risk drinking rate is, it is 4 to 5 drinks for males or 3 to 4 drinks for females in a window or in one event, usually with 1 or more of those drinks occurring per hour. Notably, among those individuals that are consuming alcohol at this rate, 25%, about a quarter of them, are under the age of 21. And if that isn't bad enough, we have something called extreme ritualistic alcohol consumption. This really denotes twice the level of high-risk drinking. So roughly 10 alcoholic beverages for males and 8 alcoholic beverages for females. We see about 16% of those game day attendings drinking at this level. And among those 16%, we see about 10% of those individuals being at the underage level. And you can only imagine some of the health consequences that these individuals face in the near future. And just worthy of noting, this is all from independent studies. There is no actual national data set on game day drinking rates.
The reason we created this term, this extreme ritualistic alcohol consumption, I did that for my dissertation years ago. And I served as a ATOG coordinator, the substance abuse coordinator at the University of Florida for 8 years. And I was trying to get the university to take action. And I gave them the standard definition of binge drinking, the 4-5 measure for females, males, respectively. And I had an administrator say, you know, so what? Someone's here and over 4 hours, they have 4 drinks. Whoop-de-doo. So I wanted to show that there is some really heavy drinking that goes on during game day. Now, of course, we have that 2-hour window where we try to look at 0.08 as a threshold. So some game days are worse than others. So high stakes games, if both teams are ranked, if ESPN is there on game day, there tends to be more drinking. Night games, of course, there tends to be more drinking. Games against a rival. Up in the Midwest, Ohio State, Michigan comes to mind, where sometimes there's riots and looting afterwards. In the South, you think of the Iron Bowl, Alabama versus Auburn. And so it seems like the stiffer the competition, the more the fans want to get involved and have a tendency to get carried away. And of course, Georgia versus Florida is a really big game. I'm going to come back to that in just a second.
And alcohol use isn't just the entire scope of the problem. It's larger than this. We see alcohol policies vary from institution to institution. Some institutions may not even have alcohol policies. We see enforcement issues surrounding alcohol policies on campuses, if they're actually enforcing it, if they're not enforcing it. We also see geographical differences between institutions, some of those social norms elements as well. We see a different social constructs and social perceived engagement from north to south or from east to west. So it depends on where the actual institution is physically located and those normative beliefs or normative constructs around those. It's challenging to address because of all of this. There's no national coverage. There's no one standard fits all, one size fits all across all of the universities. So creating interventions, finding data that fits all of these universities is very difficult and challenging, which makes it problematic to address at times.
So back to this Georgia-Florida game. So when I worked at the University of Florida, we were trying to get the media to not refer to this game as the world's largest cocktail party. And they would get cute with it and say, we're not supposed to say that, but we still do. And this game's particularly problematic because it's not held in Athens or Gainesville, the respective sites for the schools. It's actually held in Jacksonville. So because of that, the students aren't familiar with the lay of the land. And back in I think it might have been 06, somewhere around there. A student actually died. He fell, he was in a parking garage and fell to his death. And, you know, all sorts of issues in terms of prevention. So it is very serious. So the purpose of this study, so it's like, okay, what, you know, there's a couple issues. What should we do? What are other universities doing? But to move the needle, what do presidents think about this issue? And that was the research Dr. Castor engaged in.
So in order to do this, we had to identify a population. And there are a lot of universities, there are a lot of colleges across the United States. And just simply getting information from all of them is a very large and very difficult task. So the research team decided to use a population census of the NCAA's Football Bowl Subdivision. And if you are football fans, you might know that the Football Bowl Subdivision embodies the largest Division I universities across the United States. At the time of the data collection in 2019-2020, there were currently 130 universities in the FBS. I do realize that number comes and goes from year to year. We are currently at 131. So there may be a few differences from when we actually collected the data to how many schools are in that now, as well as schools jumping back and forth between conference affiliations.
So Division I, 10 different conferences. Okay, again, as Dr. Castor alluded to, we collected spring 2019, thankfully before the COVID outbreak. And we were really targeting presidents, and we looked up their information and we mailed them out a survey. And Dr. Castor is going to tell you a little bit about the survey and the methods.
Sure. So we'll start with the methods. We did conduct a review of literature, as is best practice, to see what was in existing literature, what had been done, to see what we could develop and what we could modify from the existing surveys. And we did come across a good one. It was a survey used to assess tobacco policies on college campuses, specifically among presidents. So we had a spot to start from Dr. Rendell et al. From 2014. We took the survey, we modified it to suit our alcohol needs, and we ended up coming up with a 4-page, 20-question survey questionnaire. And in order to send this out, we utilized multiple different waves as well as methods of sending this out. And some of those just including paper and pencil, via actual physically mailing of that. I know it's very old school, but we tried it. And we also did an online survey as a follow-up to that. In order to add a little validity here, we did include a personal cover letter to each of the university presidents or chancellors of their current time frame. And that cover letter was sponsored by the University of Toledo researchers, as well as the Higher Education Center, specifically with Dr. James Lang's permission and signature on that. And as always with best practice, we incorporated theoretical constructs. The two theories that we used were the health belief model and Transtheoretical Model. If you're not familiar with either of those, more to come, stay tuned. In terms of validating the survey, utilizing the existing survey, we also used statistical analysis in terms of analyzing face validity, content validity, and construct validity of each of the items on our survey.
All right, so as Dr. Castor indicated, we use the stages of change. I think most of you are familiar with that theoretical model. In other words, how ready were college presidents, university presidents, willing to address their tailgating policy? That's what we wanted to know. What was their level of readiness? And then we wanted to see, were there barriers to implementing a tailgating policy? What were the benefits to implementing a tailgating policy? And then we want to know, did college presidents think this was a serious issue? Did they think that their campus was susceptible to some of the issues associated with high-risk drinking? So that's why we use the health belief model. And then we also got background information on the different universities, more to come.
Thank you. And in terms of those mailing waves, we utilized 7 different total waves to obtain our data. The first 3 waves were physical mailed surveys with their corresponding cover letters, a self-addressed returned envelope in each of those. In terms of the 4th, 5th, and 6th wave, we moved those to an electronic survey utilizing SurveyMonkey. And then after the 6th wave, I took some time and I actually picked up the phone in my office and gave all of the non-respondents a ring, usually the office of the president. I got a hold of their administrative assistant and cued them in as to what was the research that we were trying to conduct and if they could help us out by getting this onto the president or chancellor's agenda. And then we sent out, following that, we sent out a 7th email survey and we saw some good responses from that.
Okay, so we did a data analysis using SPSS, if you're familiar with that. We ran a bunch of different analyses, some of you which might be familiar with, including the logistic regression, probably the most important.
All right, and in terms of responses that we got back, after removing the universities from the pool that said they didn't want to participate in the study, we had about a 49.5% response rate, total of 59 surveys. And remember that this was sent out directly to the president and or chancellor of each of their institutions. We see 3 different levels arise with who actually completed the survey. We see president, chancellors, vice presidents, which we coined senior level administrators at 54%. We see mid-level administrators, your deans, department chairs, program directors at 20.3%. And finally, we see specialists on campus, AOD, ATOD, health promotion, wellness coordinators, etc., at 15.3%. What is interesting here is that we did send it to the top, and it's impressive that it made its way down to the individuals at the practitioner level.
We know that university presidents are expert delegators, as you can see, and many of them kind of pass the buck a little bit. But we did get a high level where either the president or the chancellor or the VP filled it out, over half. So that was good. All right. So again, what are these research questions? What is this all about? And the first one is, what actions are universities taking to address alcohol use associated with college sporting events? So on game day, what are universities doing to try to make the atmosphere a little bit safer as it pertains to tailgating and alcohol use?
And some of those general prevention practices are listed here in this table. You see wellness statements, biennial reviews, tobacco policies, alcohol fatalities, and ticket sellout sales in terms of indicators. You can see just by looking down through that yes category at some of those percentages, including 70.9% of those in a wellness statement addressing alcohol use on their campus. We included that biennial review. Part of that biennial review is documenting the alcohol use that occurs on college campuses. It's just one aspect of that. And then one other to touch on is that tobacco policy. Many of you might be wondering why we're interested in tobacco policy. We thought along the lines that if a university had a tobacco policy on the books, they might be more likely to also have an alcohol policy on the books.
And this was a tobacco-free policy. And we also thought that if there was an alcohol fatality, they might be more likely to take action in general. And then we want to see, these big time universities where their stadiums sold out, how that might affect the data. So some interesting results. No re-entry. When I was at the University of Florida, we worked really hard to pass this policy. So the deal was, during halftime, there was no alcohol sold in the stadium. So a considerable number of people would run across the street to the bar, try to down as many drinks as they could, and then return back to the stadium. And we said, no, you can't come and go. Later, this is probably within the last 10 years, we see this text alert system. If there's problems with the fans, you can text security. There are some alcohol bans in the stadium and on campus. 66, 2/3% had a safe ride program. What about restricting alcohol marketing? Over half the sample did that. I thought this was interesting. Sell alcohol in the stadium. About 2/3 sell alcohol in the stadium. I think that number's increased over the years. And over half have an alcohol-free tailgating area.
And just to further examine those that sold alcohol in the stadium, breaking it down into 3 different components here, we see that 82% did have a limit on the number of actual beverages that one individual could purchase from the concession stand at one time, whether that be 1, 2, or 3 alcoholic beverages. They did prohibit you from buying 10 alcoholic beverages and passing them out to all of your buddies or your friends. They also had limited time frames when alcohol would be sold in the stadium, and most notably, these timeframes cut off at the 3rd quarter. They would sell alcohol up to the 3rd quarter, and then the 4th quarter of the game would be a dry. We also see that 95% of them prohibited the sale of alcohol to intoxicated individuals.
We did ask a question about enforcement. So we have these tailgates, and does the university allow alcohol at the tailgates? And whatever the policy was, do they enforce it? And if you look, only about 1/3 always enforce it. And then you see often is about 1/5, sometimes is about 1/3, rarely you're around 15%. And none of the universities indicated never.
No big surprise there. Yes. So the second thing we were looking at was the Transtheoretical Model, and really assessing what stage of change university presidents were indicating their university is currently at in establishing a policy regulating alcohol use, specifically during tailgating events.
All right. So what do we find? Really, the data here is polarized. So about a quarter are like, we don't have a policy, we're not considering a policy, not on our radar. Conversely, almost 2/3 said, yep, we have a policy, it's been in effect, it's been in effect for more than a year, and they indicated that they were at the maintenance stage. And then we dichotomized the data just to reflect, that the university has a alcohol policy regulating alcohol use in tailgating areas. About 2/3 said yes, about 1/3 said no.
And the third element that we sought to identify were the characteristics or general characteristics of universities regarding policies regulating alcohol use during tailgating and college sporting events. We really wanted to know what some of their basic information was, what the universities looked like in terms of size, institution, and other factors.
So we thought, again, if a school has a tobacco policy, maybe they're more likely to have a tailgate alcohol policy. We thought if you had a president who had been there for a while, maybe this president would be more comfortable, more likely to enact a policy. We thought if there was an alcohol-related fatality, again, more likely to have a tailgating policy. What we found out is none of this background information meant beans about a university having a alcohol tailgating policy. So, you know, respective of where your school is at, really none of these issues predicted or were associated with having a tailgating policy regarding alcohol use.
And finally, the fourth research question, we were examining which areas of the health belief model would be most predictive in establishing a tailgating policy on campus during tailgating sporting events.
So if you're into the data, if you're into the analyses and you want to get in the weeds just a little bit, here's the results of the logistic regression. And we'll simplify this for you. But basically, in a nutshell, you know how we talked about benefits, we talked about barriers, susceptibility, severity. The only thing that predicted having a tailgating policy regulating alcohol was these benefits. And we saw inverse relationship here where if the benefits were perceived as minimal, presidents, senior leaders were less likely to endorse having alcohol sales within the stadium. So it's all about the benefits here. Now, mind you, this is one theory that we use, the health belief model. It accounted for about 10, 11% of the explanation. So there's other things going on than just this theory, but this theory does shed a considerable amount of insight.
And in terms of the Transtheoretical Model, it's important to assess where current universities are at because we want to meet people where they're at. They need to be able to be amenable to change. They need to know that the problem exists. And as you can see from our data, universities reported various levels of readiness across the board. A lot of them did already have policies on the books in the past year. However, a significant portion of them were still undecided and didn't know if they had a policy or didn't have a policy, didn't plan on implementing a policy anytime in the near future. And then maybe it's those universities that we need to target and make changes. In terms of enforcement of those alcohol policies, those varied at best. As you can see across the board, some were often enforced, and we had a highest percentage of them being always enforced, but it's still not all of them, which begets the question that if you're not enforcing a policy, what good is a policy?
Right, so one thing we kind of wondered after the study was conducted, university might have a policy that says no alcohol on in tailgating areas, but as you can see down here, they're not enforcing it. So more research needed, clearly. So, but what we do know is if you're trying to pass a policy on campus regarding tailgating and alcohol use, really focusing on the benefits is important. So when you're focusing on these benefits, what are these benefits exactly? One is the secondhand effects. So I'm going to keep it real here for a second. I remember being at a football game and a fan in the upper bleachers got sick, threw up, vomited on people below them. That ruins the game day experience. Seeing someone urinate in public on campus dampers the campus environment. These secondhand effects are real when you have 100,000 people, many of which drinking excessively. The other thing, and I remember as a college student when I was younger, looking around on game day and seeing everybody drinking a beer, having alcohol, so many people much older than me doing this, I thought clearly this must be legal if everybody's doing it, which isn't necessarily the case. So we really send mixed messages to students. So really important to have a policy, articulate it, and everybody knows what the policy is. Very important.
And not to mention, we're creating normative behaviors on college campuses when we don't enforce these policies.
Right. If you see everybody drinking, A, it must be okay, and B, tacitly, this is the thing to do, which we don't believe to be the case.
So our data indicated that quite a few different strategies existed across universities, and here are a few of them listed. And as Dr. Glassman had mentioned a little earlier, you see that no re-entry policy into the stadium, which is very impactful. So individuals that are able to use their ticket once after they leave the stadium. They can't slip out to their vehicle and crack a few cold ones and then get back into the stadium. Promoting safe rides across the board. This is a wonderful university initiative, no matter what the student needs, no matter if they're intoxicated, if they're alone, if it's dark, if it's late at night, the university offers some form of safe ride system to get that student home safely. Restricting alcohol marketing, this is a big one. This is kind of twofold, as the NCAA regulates some of this marketing in the stadium, but not necessarily on the college campus or on the premises surrounding the campus. So think of it as you might see some banners for Bud Light hanging in your stadium if your university has exemptions or exceptions, or you might see billboards on your stadium promoting Bud Light as the alcoholic beverage of game day 2022. We also see promoting alcohol-free tailgating areas is a novel initiative, and this is kind of important because you are not subjecting all of your students to those normative behaviors of consuming alcohol in parking lots or in their respective areas, but you're also offering safe alternatives for students to engage in activities. Not to mention, not everybody that attends game days wants to consume alcohol. Maybe they're looking for something a little more family friendly and they have children with them and they don't want to expose their young children to the profanity of intoxicated college individuals. Texting alert system. You're good. Texting alert systems is another big one. A lot of campuses are doing the emergency beacons. This is an additional topic to that, where you can report unruly fan behavior to the authorities, and authorities can address that wherever and whenever that behavior may be occurring. And then finally, banning that alcohol use during tailgating has been utilized in the past. And Dr. Glassman and myself are not saying that abstinence is the end all be all. It is just one of the potential strategies that we're seeing across different universities.
Limitations. So as Dr. Castor alluded to, there were roughly 130 people invited to participate. We got about half of them. So that's a small number, 50 some odd participants. Is that right, Dr. Castor? Something around that, maybe 60. So anytime you have that small data, you have to be careful. Also, this was cross-sectional research. So we don't know if the constructs resulted in the policy or the policy resulted in the constructs. You got a chicken egg issue going on. And then if you are from a smaller school, this research was conducted at Division I, so it might not apply to Division II or smaller schools. And then you have self-report data issues. The person completing the survey, university is a big place. They might not know if there was an alcohol fatality. They might not know if the biennial review was completed. Also, I'll tell you, social desirability on this particular survey was important. I'll tell you, at the time we conducted this research, our university president, we were asking her to sign the letter out to other presidents, and she didn't want to do it. And she actually didn't even want us to conduct this research because she's worried that universities might look bad. We had to reassure her that this was anonymous data and those sorts of issues. And it's really an important issue to get out to the broader public. But there could be, when we talk about enforcement, someone's filling out that survey. Yeah, we enforce our policies. Well, maybe not always, maybe not most of the time. So issues to consider when you interpret this data is all I'm saying.
And in terms of future research, I always encourage students and fellow practitioners to utilize multiple methods, modalities of research. Just the one gold standard is going to be that intervention-based experimental research, which can often be costly and very time-consuming, but provides some of the best and most accurate data that we can get. Examining restrictive alcohol policies and actually determining if those policies make a difference on college campuses is going to be instrumental. Studying the impact of those designated areas and other elements on alcohol, on game day surrounding alcohol use is going to be important. And those policies need to be studied by themselves in isolation as well as with the other policies at that institution comprehensively. It'll be important to denote if that one policy made a significant change or if it was some combination of those policies at that university and across the universities as well. And as we see from this particular study, again, sent to college presidents and trickling down through different tiers and different levels, having a key individual or interviewing a key individual at the university might be key. Identifying that one person that is standardized across the board, whether that be athletic directors, ATOD coordinators, etc. Finding someone who is knowledgeable in this area and has a background and can accurately represent the data or the university is very important. And maybe the college president wasn't that person. This study just helps reinforce some of that information. And finally, conducting research utilizing other theories out there, not necessarily just health behavior theories, maybe even interdisciplinary theories is going to be instrumental in moving the research forward.
So what we're talking about with this, let's say you do have a designated area where you allow alcohol, and do you allow it for 1 hour, 2 hours? How big is that area going to be? And this is really hard to research because you can't necessarily do a control group because universities are so unique. And then getting universities to do things at the same time, it'd be hard to get multiple universities to do multiple interventions simultaneously. So there's probably not going to be a control group. There's probably not going to be random assignment. But at your university, if you do adopt a policy, try to get some baseline data and then post-intervention data and see if there's any changes. I think that would be a great first step, is just to try to do some evaluation at your own institution. The main thing we want you to do is, you know what game day looks like at your university. My guess is we need more prevention. This is a serious public health issue. Back in the late 90s, early millennium, the Higher Ed Center created this document, this pamphlet, where they're trying to get university presidents to be vocal, visible, and visionary. We believe that the president is the key person to move the needle on this issue. So it's very important to get them involved. And again, we want to emphasize, if you are working with your president, talk about all the benefits of implementing protective policies. Whatever you do, if you do implement a new policy, make sure it's well publicized. Use those health communication campaigns. And then I think it's really important, as Dr. Castor alluded to, if you're not going to enforce the policy, it's really no good. The old metaphor of the three-legged prevention stool without enforcement, it just does not work.
And some areas of additional ideas: recruit a faculty member that can help you. If you're a campus practitioner, those research individuals that teach and research at your institution can be very powerful and provide excellent insight into statistical analysis, designs, and conducting the actual research. So recruit a faculty member. If you don't know where to start, ask around. Someone will eventually point you in the right direction. And if you are a faculty member, maybe recruit one of the ATOD coordinators on campus to help you with some of this research. Data drives decisions. It is you treasure hunters out there, or treasure hunter fans, the Marty Lagina would always say, show me the data. Without the basic data, we really have a hard time or difficult time presenting this information in terms of making sustainable policy changes. One additional area or individuals that you can invite is faculty senate representatives. These are going to be individuals at the top of the university that have a very influential pull. They can help you get the policies pushed through to the top, as well as help you make significant changes that are sustainable and lasting over time. Notably, these individuals, if they're on board with you, can be very beneficial. However, if these individuals are not on board with your research, they can also be identified as barriers.
So let me give you an example. When we were trying to get our campus to go tobacco-free about 5 years ago at the University of Toledo, this is something I'd worked on for years and years, and I could never get it through. Then finally, we made it an item on faculty senate. Faculty senate supported it and really had the president's ear. Boom, the policy passes, and we have a tobacco-free campus. Without faculty senate, it was just dragging and dragging and dragging. Of course, we work at universities. Students have the power. We always want to know what students have to say, what they think. They have a tremendous amount of influence, particularly student government. And I've talked to students about tailgating on campus and what it's like on game day, and some students hate it. Their living environment gets turned upside down. The campus becomes just this giant party, and it gets trashed. That's a mild picture compared to what game day sometimes looks like. So, you know, students live on campus, they live in the residence halls. How does it affect them? What can we do to make the living environment safer is really important. So recruiting students is a powerful strategy.
And one population not to overlook are those alumni. Those are the individuals that are making those significant donations, those $1 million donations to the university. They have influential power and sway over some of the policies and practices that are implemented across the board. So surveying what the actual alumni want, their opinions of the matter, if there's a problem, and some identifying potential solutions to that problem is very important. Supporting designated drinking areas is just one example of that. Individuals at the University of Toledo indicate that they may not want to be in the middle of a parking lot with 1,000 other fans or 2,000 other fans, where individuals are being rowdy, disruptive, doing a Dukes of Hazzard hood slide across your car, etc. So having specific areas where it is contained, it is safe, and alcohol is not allowed is just one potential strategy.
So I did research several years ago, and what I did find out is alumni are in support of designated drinking areas. So, you know, certain parts of campus, alcohol would be allowed. Maybe even the university sells it, checks IDs, checks for making sure people aren't drinking who are already intoxicated, limit the number of drinks. The university could even make money on this policy. And then other areas, other parking lots, no alcohol whatsoever. That way we clearly articulate where and when alcohol can be drank rather than a free-for-all. And, you know, I hate to say it, but all too often there are alcohol-related fatalities. And, you know, it's our job to try to prevent those. And sometimes in spite of our best efforts, these issues happen. I happened to, this picture was taken at the University of Toledo. I happened to be walking by on game day, and sure enough, somebody's on a gurney. And I didn't time this, I didn't stage this. I just happened to randomly be walking by after getting out of my office during a game. So, you know, if something tragic happens, take advantage of it, use it as leverage to get resources, to pass protective policies. Don't let somebody's life go in vain, and let's prevent future tragedies. And sometimes when I frame this issue, I'm like, you know, most of us, you know, I love game day. I love college football. I could talk about it all day. I enjoy drinking in moderation. So I'm certainly not anti-alcohol, but nobody wants to see somebody die. Nobody wants to see someone go to the hospital. No one wants to see somebody drop out of school because they're partying too much and have an issue with alcohol. So I think that's an important way to frame the issue.
Having policies on the book and regulating those policies will go a long way, absolutely. And of course, with prevention, nothing happens overnight. It takes time, it takes persistence. You might get shot down along the way multiple times, but keep at it, keep persisting, keep collecting that data. It doesn't necessarily matter if you're able to change the needle from one end of the spectrum to the complete opposite end of the spectrum, just as long as we're working on changing that needle along the way. Incremental work is crucial, especially when you're faced with a daunting task. As an example, maybe your university isn't ready for a change. If they're at the pre-contemplation stage of the Transtheoretical Model, and you would really like to have them at the maintenance stage of that. If they're not ready to make a change, maybe just addressing those stages of change, collecting some data, presenting that data, representing the issue to the university is where you should start. So those small little incremental pieces can add up over time. Don't bite off more than you can chew. Don't try to change the world overnight is what I'm really saying. And as always, there are low-hanging fruit out there. in academia, a lot of the times we're afraid to go after those. I encourage people not to be afraid. And what I mean by that is if you walk across your campus, you're going to see problems or issues. If you go to a game day, you're going to see alcohol consumption issues, etc. Many people will think there's policies on the books. They'll just assume that someone is addressing that since it's such an obvious concern. And that's not always the case. So don't be afraid to take some of those obvious concerns that you're seeing on your campus and start addressing those. Again, alcohol-free tailgating areas are just one of them. And I will make a harmless plug for social norms marketing campaigns. Dr. Glassman and I both teach these. These are great ways to address any of the normative beliefs or normative behaviors on college campuses that students are currently engaging in. We both involve our students in creating these campaigns, collecting these data, creating these informational flyers, and publishing these flyers as well across the university. So here's an example of one from the University of Florida, Respect the Swamp, addressing that most students only drink 0 to 4 drinks on game day, where that might not be the social normative belief among that culture on game days.
So again, some of these strategies are easier to implement than others. You know, you would assume that nobody's against an alcohol-free tailgating area. We did this at the University of Toledo. We did this behind our rec center. We opened up our volleyball courts. We had free food, soda. We gave students free t-shirts. Our school doesn't have a really big football program, so it's not as big a problem as some other schools, but we got good participation. People really appreciated it. Tom, I'm gonna let you talk about the summary here.
And if you're trying to engage students on campus, students will line up for anything that is free. If you're doing any sort of giveaways, t-shirts in particular, you'll have a line out the door for students. And it's a wonderful opportunity to get that information out there or to address a social marketing or health communication campaign.
By the way, before you jump in, just getting people to eat on game day is a harm reduction strategy. So giving people some free food is not a bad idea.
Very, very true. Thank you, Dr. Glassman. So in summary, who has the decision-making power on a university campus? That is going to be the college presidents or chancellors, but who influences that individual or those individuals on your college campuses? And that is multifaceted across the board. We're seeing a big student population play into factor there, faculty and alumni. And you know, as President Truman had once said, it is amazing what you can accomplish if you do not care who gets the credit. So be willing, be open to work with other individuals on your campus. And really at the end of the day, it doesn't matter that your name's on the publication, or it doesn't matter that you're responsible for creating that policy, as long as the policy is in existence and is being enforced.
Yeah, so you have the opportunity to be viewed as the catalyst. Sometimes I would joke when I was the ATOG coordinator or substance abuse coordinator, you know, I'd throw something out there, would get batted down, and then somebody higher up would pick up the idea and I'd be like, that's brilliant. So giving other people the credit goes a long ways. Remember, there's all sorts of different interventions you can work on. You know, maybe try to pick one a year that you're adding, whether it's the no reentry policy or alcohol-free tailgate, or if you are serving alcohol, making sure that IDs are getting checked, people who are intoxicated aren't getting served. Banning alcohol in certain areas might be wise. You know, it's up for you and your school. Do a needs assessment, see what's feasible.
And in terms of publishing some of this information, right now we are under review with the Journal of Student Affairs Research and Practice, the NASPA journal.
So hopefully you'll see that in the books coming up. Do you all have questions for us? I'm going to stop sharing the screen here.
Thank you so much, Drs. Castor and Glassman. If you do have questions, please now put them in the Q&A. We would love. We have a few minutes to ask those. While those questions are coming in, I did want to ask the first one that we had come in. This is to both of you. When looking at the research, did state law come up at all? So I think I spent time in graduate school in Louisiana, so I would love this when the question came in. And then so did state law come up at all in the ability for a campus to have or not have a tailgating policy?
State law really did not come up at all. There are a couple caveats to that. Even if a state did have a law on a college campus and they had to follow that, there were permits that universities could file for it that exempt them from that on game days in particular. We didn't really focus on identifying each of the 50 different states' laws. So not something we looked into.
So, but to add to your point, so that really wasn't part of our research, as Dr. Castor stated, but that is sometimes a deal breaker or a deal maker depending on your campus. And in my experience, no matter where I've worked, and I've worked at 4 different institutions, they always want to know what the parallel school is doing. So another school in the state, if they're doing it, we're doing it. We see that in academia with Blackboard or whatever it is, it's keeping up with the Joneses. So if there's a school in your state that passed a policy, you know, that's a great way to say, you know, such and such university did this, we should too. But there are limitations in terms of that open container, what can be done at the state level. But one trend I've noticed, and this is in some ways this is problematic, but good for this particular issue, is the open container, and Dr. Castor, you can chime in here too. The open container rule is becoming more lax. So universities, particularly in our state, in my state, Ohio, there is a law where you can let people kind of roam around with an open container in a designated area. And as long as you don't go outside that designated area, you could have that open container and it wouldn't be against the law. But that might not be true at another state, but certainly the alcohol industry is in favor of this policy. So generally with prevention, you try not to increase accessibility, but with game day, you see so many people breaking the policy. It's important that the policies reflect our values. So if our value is to really let people tailgate with alcohol, it should be legal in certain areas, but not others, in my humble opinion. And then it should be regulated rather than come on in on game day, bring whatever, bring your keg or bring your bottle of Jack or whatever it is, and just have at it for 8 hours. And you have 100,000 people doing that. You know, someday we're going to look back at this and say, we did what? We allowed what? Like I joke on a Wednesday afternoon, I couldn't just pop open a keg and start hanging out in the parking lot and drinking as much as I want. I'd be hauled away. But on game day, apparently it's okay. So there just needs to be some regulation. And if the state law, if your state law won't allow it, then it's time to work on the state law. And again, I think this is one time where you could partner with the alcohol industry and make it okay for certain areas. But it's complicated. There's a lot of proverbial balls in the air, and you need to be careful you're not making things worse. So it's complicated.
Fantastic. Thank you for answering that question. That is all the questions that have come in. So just one more big thank you, Dr. Glassman, Dr. Castor, for sharing of your time, of your talents, and of your research. And one, thank you for doing this research. I know in my short time at the center, we've had questions come in. Is anyone doing research on trends on game day and tailgating? And now we can say, yes, the research is out there, it's being done. So thank you for engaging in this research because we do know it is meaningful and is making an impact. So thank you for sharing that. Dr. Glassman.
One last thing, another study that Dr. Castor led was a literature review of all the research that's been done on game day. And I don't know, there's roughly 20 some articles that Dr. Castor summarized what they found, the strengths and weaknesses, and that's all in one place. And that article is under review as well, but that will be invaluable for people to get that one journal article and see all the research that's been done. So that's hopefully we'll be impressed soon enough, but we were certainly trying to recognize that there hasn't been much work done, but we want to highlight the work that has been done and really highlight how we can get presidents involved, because this is such a political issue. If the president isn't on board, it's not going to happen, in my opinion, at least.
I completely agree. And there's a very limited number of articles out there in the databases and in the literature surrounding on game day. So I encourage anybody that's interested to get out there and conduct some research of their own.
Awesome. Well, thank you both one more time. I do have a couple housekeeping slides that I want to go through just and thank people for being here. Thank you for staying with us for this hour. Just want to remind people that are coming up. So we do have a next session in our learning collaborative, our environmental prevention learning collaborative. We're going to be talking about engaging community partners, and that'll be on April the 6th at 2 o'clock with Dr. Sally Anowski and Amy Horgan. For our water cooler chat series for the month of April, we will be helping celebrate, Collegiate Recovery Week with the interim executive director of ARHE, Christina Canfield. So hope you can join us for that. And with that, as always, we hope you can continue to connect with us. We hope to see you on our next webinar or our water cooler chat. And with that, we hope you have a wonderful rest of your day and week, and take care. Thank you so much, everyone.
Thank you. Bye-bye.
Thank you.